Hi everyone, hope you're doing amazing. So I welcome you all to Vitaliss Health Coaching webinar. My name is Arpit Arora. I am one of the senior advisors here at Vitaliss Academy. So today we are going to be going very deep into health coaching, how you can start your health coaching practice. If you're a fitness trainer or a doctor, MBBS doctor, a cardiologist, a physiotherapist, fitness instructor, or anyone and everyone who's into health coaching or are passionate about health coaching, uh, this health coaching course is really going to help you go deeper into helping yourself, people around you who are suffering from lifestyle disorders, right? So in this course, what we talk about is functional medicine, of how using functional medicine you can figure out the root cause analysis and help people with the root cause treatment, so that you can help them reverse these issues. So issues would be like diabetes, thyroid, PCOD, PCOS, cardiovascular issues. These are the kind of lifestyle disorders that you can help your clients with, parallel to, of course, they are already with the doctors, parallel to the medications that they are on. You can run this parallel so that you can help them get better in terms of health, right? It's not disease management, it's health management. We are also going to be talking about how you can get into the business side of things. You Once you become a health coach, the next step is to build your own business. Or if you want to get into the placement side of things, we of course assist you with all of that. Just setting the ground rules for this webinar, right? So it's going to be a 45 minutes session wherein we'll start with the basic introduction of what we do, why we do what we are doing at the moment, why Whitelist Academy, why are we doing health coaching in the first place, right? And then you can keep dropping in the chat if you have any questions. We'll just go over it at the end of the session and stay till the end, right? So there are bonuses, scholarships in place for medical students, non-medical people, students who are in college, who are studying medical, right? So all of these bonuses and scholarships we're going to be talking about at the end. So I would request all of you to stay till the end, right? So I am just going to present my screen. We'll just go step by step of what we have to offer here, right? So I welcome you again to the health coaching webinar with Vitaliss Academy. So what we are trying to build here is army of health coaches, successful health coaches, right? So we are on a mission to help people who have lifestyle disorders, like I mentioned, diabetes, thyroid. So we are training health coaches so that they can help them reverse these issues from the root level, and then later also build their successful businesses, right? And so yeah, just setting the ground rules. So we are going to be talking about building successful health coaching businesses. Agenda is to discuss about growing health coaching industry post COVID. Everyone has gotten aware about why it is so important to take care of your health, right? India is set to become the diabetic capital of the world. So there is an urgent need for the health coaches to step up, do whatever it takes to help people who are suffering, right? And then build an online coaching business. We are also going to be talking about, and then we'll at the end we'll talk about the key takeaways. Just to give you a little background about what I do. So I'm a marketer and a sales professional. I have been working with the biggest of the biggest brands out there in the health and wellness industry, right? So I've worked with Cipla for their online spaces, right? So their digital marketing vertical I was handling, right? Cipla Foundation, you might have heard about it, wherein it's for Cipla Foundation is like a CSR activity that they do. So I've taken care of that. Pfizer, all of these brands we have worked with, and as a founder of Jazz Nation Media, so this is an agency through which I help health and wellness brands. And then the idea is to promote holistic wellness. So why I have tied up with Vitaliss Academy as an advisor, as a senior advisor, is we want to really create an impact, right? Apart from just doctors, doctors are playing their role, but yeah, parallel to that, there's a very urgent need for health coaches to come in and help people with their lifestyle disorders, right? So just to give you a quick brief of what we are doing at Vitaliss Academy is we are dedicated to helping you become a health coach and a successful one, right? And eventually you want to be able to build army of health coaches who are able to help reverse lifestyle disorders like diabetes, cardiovascular issues, and PCOS. Goal is to empower you to build successful online businesses as a health coach. Why we prefer online is, of course, it's always good and great to have clinics and people coming in, meeting them face to face. But of course, if you want to create a scalable business, online helps you to not have those boundaries, right? So being in Delhi, you would be able to help clients in Bangalore, Pune, Chennai, etc. So that is why we prefer online, just with the website and driving ads to your website for your coaching businesses, having a proper marketing and sales funnel. You can really build a successful online businesses. We've been able to help thousands of students till now, and of course, we can help you as well, right? And why you do this in terms of monetary benefits, we can talk about. It's set to become a $638 billion by 2025. We've discussed this before, that healthcare is the biggest contributor to GDP at the moment, right? And preventive healthcare, there is a massive gap, right? Which in turn creates the demand for health coaches. Preventive healthcare is, so the people who have diabetes, PCOS, cardiovascular issues, the first option is to go to a doctor, right, a specialist. They go over there, they take medicines, they pop a pill or whatever that medication that they are on. But parallel to that, you need to heal people, right? Medicine is just a symptomatic treatment. Parallel to that, there has to be like healing that has to happen from within, which includes gut health, which includes, taking care of the insulin levels and taking care of all the body organs, right? Taking care of metabolism. So all of these things are included, right? And lifestyle disorders, it's said that in India, 1 in 3 adults suffer from lifestyle disorders, and 50% don't even know about it. So there is a really urgent need for the health coaches to step in. Why health coaching? And I know there are a lot of nutritionists and fitness trainers here in the meeting, but health coaches goes way beyond than just nutrition and fitness, right? So it's basically about lifestyle, and lifestyle pretty much includes the moment you get up in the morning to the moment you sleep at night. It includes everything, right? Your sleep cycle, the food that you eat, the kind of food that you eat, analyzing your gut health, and if there are any allergies to you. A lot of children say, hey, I don't feel like having milk or ghee or whatever. We don't even know if they're lactose intolerant, but we keep asking them, hey, have milk, it's good for you. And there are a lot of things, right? People are not aware about what's the right kind of food, what's the right kind of lifestyle. And especially, I would want to talk about the people who are working, on the laptop, especially the IT professionals who are on laptop for 12 to 14 hours a day, right? And especially the people who are working in the US shift. So there's a, and that's like the 60% of the total like community that I am in at the moment, right? So there's a really urgent need for the health coaches to help you bring back to the lifestyle that supports you, keeps you healthy, right? And we focus on teaching you how to prevent these from the root level, right? Which is basically root cause analysis, root cause treatment, and it takes time, but that's how the way to go about this is. And why is there a best time? Why is this the best time to become a health coach? Because of course there's like a demand for 10 million coaches needed by 2025, and if you're an experienced health coach, these are the opportunities that you have in front of you. One-on-one coaching, of course, it's available to everyone. A lot of you nutritionists and fitness trainers might as well just be doing that right now. And corporate wellness, we help our students to get into corporate wellness. We help with the corporate tie-ups, right? And then a lot of our students and our instructors are health influencers. We do the brand collaboration if that is the space that you want to get into. And of course, e-commerce, if you want to start your athleisure brand, if you want to start your supplementation chain, or if you want to start something in this, right? One of my friend, he has started a brand in Ayurvedic for just for men's sexual wellness, right? So lot of these spaces have opened up for the health coaches to come in and then build a successful business on top of that. And then of course new coaches can get into it and start with one-on-one coaching first. Once you're confident with your practice, of course go into the group coaching model, get into a corporate wellness, and then we are there with you at every step of the way, right? One of our graduate, right, Namrata Vijay Kumar, life coach, psychologist, mental health, very successful in her career. But of course, right, there's a she wanted to know more about the physical aspect of things as well, right? Uh, because a lot of these mental health issues they come from the physical aspect of things as well, right? So she wanted to be trained in that, came in, was able to 5x her business, right, on in the online space. Of course, a very successful life coach already. And then Rahul Jain, a life coach, now a health coach. Parallel to that, been able to 2x his business. Comes from a very successful family background, but yeah, still want to do something of his own, and we are grateful that we were part of his journey and have been able to help him there. Sahil Kokar, a very successful yoga instructor, very reputed in the community. If you get into yoga, you might have heard about him. He's been seen with Dr. Narendra Modi during these international yoga sessions that he does, right? So he's the leading instructor there and worked with us, became a health coach, now has been able to really create an impact. But yeah, that's about this. What I want to do is I want to introduce you to our guest today. His name is Dr. Anish Musa, a very reputed doctor in the field of functional medicine and comes with an extensive background of more than 2 decades. And he's also like one of the pioneers in the functional medicine space in India. So it's an honor to have him here. He's also a founder of IAFM, Indian Association of Functional Medicine. And great to have you here, Dr. Musa. Would you like to share something with our attendees of the webinar today?
Okay, thanks very much for having me. And thank you very much for both of you. And
I think there's a voice issue, Dr. Musa.
can you hear me now?
Yeah,
Can you hear?
much better. I think it's distorting a bit.
Yeah, let me just share one. Okay, yeah, can you hear me now?
Uh,
Let me
mm,
see.
yeah, I think yeah, it's not coming through. Maybe just switch to a different audio source. Try Dr.
Yeah.
Musa if that's possible.
Mhm. Can you hear me now? Is it better?
Yes, loud and clear, Dr. Musa.
Loud and clear. Okay. Oh.
Yes, great to have you here, Dr. Musa.
Yes, again, thank you very much for inviting me in this webinar. And you rightly said, I'm listening to a lifestyle disorder. And if you look at the India, then actually I say that we have a tsunami of chronic conditions. And earlier, I'm talking to some of nutritionists and some of doctor. And right now, the paradigm shift is there that patient will not come to a doctor when they have a lifestyle disorder. Now, let's say we talk about the lifestyle disorder. Then who is the primary take care of this lifestyle disorder? Not doctor. We call them as a lifestyle disorder. So this patient should come to a lifestyle coach. They need to learn the lifestyle, and doctor cannot teach a lifestyle. It's an entire different thing. So if you look at the all the aspects of Ayurveda, allopathy, and lifestyle, then there is a one simple beautiful science that was created 30, 40 years back by the Jeffrey Bland, and he had came out with a fundamental of how we can find out the root cause of this chronic condition. So with that thing in mind, I quickly share my screen, and I just want to show you something that you understand what is actually a lifestyle disorder. And I will teach you in briefly what is functional medicine and what we're going to teach you in Vitaliss Academy. So as Arpit had said rightly that we are having a tsunami of chronic conditions. And if you name the disease and disease will be here. Like if you talk about the diabetes, then almost 25% of adult population right now in India, they are suffering with an pre-diabetes and diabetes. You will be surprised by knowing that 21 to 24% of patients they have hypertension. 20% of patients right now in India they have a abnormal thyroid functions, thyroid disorder. And 50% of these patients they don't know about their condition. Forget about the root cause. They even don't diagnose this one. Even I'm not including the Alzheimer or stroke or chronic lung disease or kidney disease and cancer. Everything is rising right now in India and around the globe. And still we don't know what is the cause. In all medicine, if we talk about the Ayurvedic medicine, if we talk about the allopathic medicine, we have a symptomatic treatment. We just manage the symptom. Nobody is looking at what is the root cause and how to treat this root cause. So let me just show you something that you can understand what functional medicine can do and how you can change your practice, how you can learn functional medicine, and you can help more and more patients. So simple things. If we don't find out the cause or if we don't find out the solution in the box, we have to think out of box. So for a moment, for next 14, next 30 minutes, I would like to think about that change your thinking. I would like to change your thinking. I would like to change how you can think differently and you can find out the root cause. So just for next 30 minutes, keep your all the learning out and just listen to my new voice and new learning that I would like to change your paradigm. So I would like to change your thinking. Now, what is the most common question that patient is asking when they come to our clinic? And usually, as a practitioner, as a doctor, because I'd practiced medicine for more than 2 decades, the two questions that patient is constantly asking subconsciously, and as a conventional doctor, we are failed to answer that. The first question is how I develop the disease. Hey doctor, how I end up in your clinic? That's the first question. And usually doctors say, this is aging, I don't know, this is because of that thing, but nobody is giving a concrete answer. So in a lifestyle disease, if you look at the functional medicine view or functional medicine point of view for looking at the root cause, then you can see on the right side, on the bottom of tree, there is a root. And if you look at the root, then there are 5 modifiable lifestyle factors. Of course, everybody know this one. They are the sleep, but you don't know sleep is not the only one. Sleep, and we call them as a relaxation. People sleep for 7 hours, 8 hours, but do they relax their body and mind for next 16 hours? No. So it's not only sleep, it's a sleep and relaxation. Now everybody know about the exercise, and many of you and many of us do in a gym for 1 hour or maybe 1.5 hours. That is important, but that is not enough. We have to talk about movement. What the movement we are doing throughout the day, and what the movement the patient is doing throughout the day. That is also the important part. Now just think about that. Somebody is doing exercise 1 hour in a gym, and next 23 hours he is just sitting and sleeping. So that's lifestyle we want to change is nutrition. Nobody know about the nutrition in conventional medicine. Even in myself, I had not educated in my conventional medical schools about the nutrition. But nutrition is important part. And if we look at as a community, as a society, we all are deficient in nutrition. I guarantee that out of 13 of class, if I do a vitamin D testing, then everybody will have a low vitamin D. If I look at the omega-3, I look at the protein deficiency, and I just want to share you the data of nutritional deficiency. ICMR says in 2015 that 80 to 90% of Indian population, they have protein deficiency in their own diet. Forget about the non-vegetarian, they have also a protein deficiency. And we talk about the stress, everybody know that. The fourth and fifth important part is relationship, how you relate to other people, how you relate to your family, how you relate to your intimate family members. So all these things are in the root, and of course, there is some disturbance in the root, and because of this root disturbances, there was some kind of expression of a disease. So as Arpita said, we want to find out the root cause, but at least we should know what is the root, what we are looking at the root. So nowadays, everybody in a lifestyle academies or lifestyle course, they talk about the root cause, but at least I will teach you in next 15 minutes how you can reach and how you can understand the root cause. Before that, we have to understand how the most people develop the disease. So this is a simple analogy I would like to show you over here that we all are born with some kind of genetic background. And in conventional medicine, we believe that genes are responsible for the disease, but that is not true. Now, just for example, let's say if you go to the doctor and you say that I had developed a diabetes, and they will say you, do you have family history of diabetes? Yes, I have family history of diabetes. And then doctor says, oh, you have family history of diabetes, and that's why you develop diabetes. That is not true. Genes are important, but they are not our final destiny. Our final destiny depend upon how we stimulate our genetics, and that is called epigenetics. And that's most important. 75% of role is played by epigenetics. We don't yet find out single gene that is responsible for diabetes, that is responsible for thyroid. There are multiple things going on. And that's why genes are important, but they are not final destiny. What is triggering that genes? So usually people encounter with trigger. Trigger may be the accident, maybe the infection, maybe your surgery, maybe your heart broken, something had happened. And that we call trigger. So what the trigger will do? Trigger will unfold the genetics. They will try to, and then genes try to express these things. But even that is not enough. What is important is the mediator, how you, what the lifestyle you have. So that is we call a bad lifestyle choice. I will not say patient have a bad lifestyle. It's a choice. We do the lifestyle with the choice. And here you will learn how to change the patient lifestyle. So because of bad lifestyle choices, the bad lifestyle choices I told you, they may be having a nutritional deficiency or stress, maybe they are not moving their body, whatever we have discussed that one. So because they were bad lifestyle choices, they start having a one dysfunction. I had not seen a single patient of diabetes, they only have a sugar abnormality. When they come to my clinic, they have multiple dysfunction. They have thyroid dysfunction, they have gut dysfunction, they have brain dysfunction, they have inflammation. And then usually they start having an one system dysfunction. And if you don't correct that dysfunction gives to a multiple system dysfunctions. And everything is connected. Now, the point of view is in conventional medicine, usually we have very narrow vision. Now look at the conventional medicine world. We have ophthalmologists, so only they look at the eyes. We have cardiologists, they only look at the heart. We have endocrinologists, they only look at the your thyroid. So entire conventional thinking is based on anatomy, structure of the body. That is important for the acute condition. Let's say if you have heart attack, then obviously we have to look at the heart. If you have something, some problem in the vision, we have to look at the eye. That's the acute condition. But here we talk about the chronic lifestyle disorder. They are called a chronic disorder. So here we cannot go with that narrow thinking and narrow vision. We have to give our vision broader. So we have to shift our thinking from that anatomy point of view to a physiology and functions of the body. The function means that we call a functional medicine, and the function means it's a physiology, physiological functions, how your hormones are functioning. So this is how we answer and what is a functional medicine. So functional medicine is, by the way, not is an alternate science, is a foundation science. It's completely based on biology. Biology means we can say functions of the body, or in a medical terms, we can say a physiology. So it's based on biological approach where we want to find out the root cause and we want to personalize the treatment. Let's say if we have a two patient of diabetes, we want to personalize one treatment for one person to personalize other person because everybody has a different lifestyle factor. Maybe somebody is only having a nutritional deficiency, apart from somebody who having a stress, who is not moving as a body, and who may be divorced. So we want to work on all the lifestyle factor depending upon patient's presentation. So functional medicine foundationally, it's a based on biology where we want to find out the root cause and we want to make the treatment personalized. So now everybody know what is the root cause, but let me show you what will be the root cause. So I will give you one concept of functional medicine and the regular thinking. So in regular thinking, let's say if we have a depression, we want to find out the one cause. So one-to-one condition is very effective in acute condition. Let's say if somebody having a fever, we want to find out the malaria. So fever is caused by malaria. We treat the malaria and fever is gone. So that's the acute condition. But let's say if we have a chronic condition of depression, depression have a multiple cause. It may be because of low thyroid function, maybe because of your antibiotic uses and gut microbiome disturbances. Maybe it's a pre-diabetes, maybe it's a combination of all these things. And if you look on the other side, and if you have one condition, let's say in this example, we can see it's a chronic inflammation. So inflammation in one person can lead to a depression, or inflammation in other person can lead to the cardiovascular disease or diabetes or cancer. So primarily we have to change our thinking from that acute model to a chronic model. And that chronic model is functional medicine concept. I am just showing you one concept of functional medicine So you can understand the patients in a different mindset, different angle. And this is what we talk about the functional medicine. I will simplify for you. Don't be overwhelmed with this functional medicine matrix. But I just want to show you how you can reach to and how you can understand the root cause. Now we talk about the root cause. Let's say what is the root cause of diabetes? What is the root cause of diabetes? We have to map and we have to find out all the factors that list and point out what is the root cause in that particular patient. Now, I just want to, I want, I will make the root cause simplify. Now, just focus on the left side of this root cause analysis, and that is your antecedent, trigger, and mediator. We talk about that one. So, how the disease develop? The patient has some kind of background, genetic background, they encounter with trigger, and because of some mediator, they start having a dysfunction. So this will tell you the patient story, how the patient has developed diabetes or thyroid or obesity or IBS. So this way you can tell the patient story that this is the way you had started and this is the way you had developed your, and these are the factor that leads to and perpetuate your disease dysfunctions. On the bottom, you can see there are modifiable lifestyle factor. Already we had discussed this one, but now I want you to focus on a center part of matrix. Now there are seven dysfunctions we can say, or seven functions we can say in a body. They are the major functions in the body. The one of the major function in the body is your assimilation, or we can say digestion or gut or absorption. So we take some food, we chew the food, we absorb the nutrient, and the rest of material we get it out. So that's the part of assimilation and gut functions. And gut is very important functions. And if you look at the Ayurvedic science, then they say that the disease arise from gut. And if you want to heal the body, we have to heal the gut. So what is the importance from this 21st century of that statement? Now we know the science, and there are a lot of things happening in the intestine, in the gut, and that whole thing is a gut functions. And many of patients they appear with the diabetes, but they actually have a gut dysfunction. So if you treat the gut functions, the diabetes and sugar level become better. Now on the other side, you can see we have an immune system, like we can say a defense and repair. So everybody know that immune function, we want to defend from the bacteria, we want to defend from the virus. So that's our defense function. But do you know that there is a very minor functions of the immune system to defend us? Now look at our army. Look at the Indian army and look at the army. What the Indian army is doing? Indian army is sleeping and only they're doing in surveillance. How many years they are doing this one? The main job of immune system or army is to defend, is to survey and sleep. And they will be active only when there is an enemy. The rest of time they are sleeping. So the repair function of the immune system has to be understood. So whenever there is a damage, constantly your body is repairing. Now let's say if your skin layer, every 24 hours you have a new skin layer. Who is doing this job? Or immune system is doing that job. Immune system is removing all the dead cells and all the debris and they will start healing. So if you want to heal your body, the immune system has to be proper. And now look at the disease category. The chronic inflammation is a root cause of many conditions. Even for cancer, you will have an immune dysfunction. In a thyroid, you have immune dysfunction. Another function in the body, we can say, is the energy functions. We produce the energy throughout the day, and 25% of this energy is consumed by our brain. So if you have a low energy or if your mitochondria are not working, you will have a low energy, low focus. So that's the functions of the mitochondria. So we produce energy. Now, if we look at the cell, then each and every cell in the body, they have at least 700 to 800 mitochondria. And by the way, do you know why our heart is not stopping? Heart is constantly pumping, pumping, pumping. Do you know that our heart get rest? No. Why? Because the one cardiac cell, just look at the one cardiac cell, there were 5,000 mitochondria. How much? 5,000 mitochondria. And if you remove the half of mitochondria, what will happen? Your heart cannot function well. So you have a lot of disease of cardiovascular disease. So but I just want to show you that this mitochondria is very important, the energy production. And look at the one symptom that we see in our community and our patients history: fatigue, low energy. Now just imagine that one patient have a low mitochondrial function, they have a low energy, low fatigue, and if you prescribe exercise, what will happen? It's a whole biological process. Let's say if you have obesity, what is obesity? If I want to define the obesity in simple terms, that food is not converting to energy, instead food is converting to fat. Now, if the food is converting fat and you prescribe the exercise, that's important. But that's not going to solve the problem. You have to look at the problem. There is some issue with the energy metabolism. There is some issue with the metabolic function. And the other most important function is biotransformation. So everybody in this room, they will know the detox. Detox is a minor role of the liver. But if you look at the functions of the liver, then it's not a detox. It's a biotransformation and elimination. So we do internal process in the liver to transform that chemical into a water-soluble chemical, and then we're going to eliminate. So you know the detox. Now detox is we have to work on a liver, we have to give some supplements, we have to do something and something and something. But do you know liver, when they detoxify, it bump the toxins in the gastrointestinal tract. So first, before optimizing your detox function, you have to optimize your gut functions. And if you don't optimize the gut function, what will happen? You will rebuild your toxins again and again. So that's the importance of detoxification over there. And then transport function, we transport, you can say cardiovascular system, we transport one molecule from the other molecule. And then we have a whole communication node. Communication means we can say neuroendocrine system where we have hormones. Now everybody know about thyroid hormones, but there are other hormones they are playing a role, like an estrogen, like an progesterone, like an cortisol. And maybe you heard about the HPA axis. So that HPA axis imbalance is a part of lifestyle coach, and that's the hypothalamus pituitary axis. So if you're imbalance in your that hypothalamus pituitary axis, you will have a low cortisol, high cortisol. You can diagnose that one. And if you look at the central most part of matrix, that we can say mental, emotion, and spiritual well-being. That is the root cause. Now just take an example of one diabetic patient and just look at that one and ask the question that this diabetic patient have any issue with the gut? So that's come in a root cause. If this diabetic patient have any issue with the immune system, yes, that come in a root cause. If this diabetic patient have any issue with the energy metabolism, yes, that's come in a root cause. If this diabetic patient have any issue with your liver and elimination, yes, that's come in a root cause. Or if this diabetic patient have high insulin or low insulin, that's come in a communication. And that's the root cause. That make it the root cause. And then you start working on one of the root cause, and you start always we have to start focusing on lifestyle. We have to correct the nutrition, we have to correct the rest of things. And then you're going to assess how we can find out the dysfunction, what we can do specifically for the gut, what we can do specifically for the immune system, what we can do specifically for the communication or thyroid. So that whole science can change your paradigm and a patient's paradigm. Now just imagine that the diabetic patient is going to the regular doctor, they see their blood sugar only, and depending upon their blood sugar, they increase or decrease the dose of medicine, and that job is done. While the patient is coming to you and you show this one and you show this, hey, this is the way you develop the diabetes, and these are the dysfunction in your body, and these are the lifestyle dysfunction you are having, and this is the next 2 month plan that we want to do. And we want to correct your sleep. We want to work on nutrition. We want to work on your gut functions. We want to work on a energy mode. We want to work on this one. What make a personalized plan for that patient. But just think about that doctor, diabetic doctor who has 30 years of experience in controlling the diabetes versus you just having a 1 year of experience, but you show this one, whom the patient will believe. Are you getting me what I'm trying to show you? And by the way, Arpita introduced me. I done my MBBS from the University of Baroda in 2001. Then I am certified completely in ophthalmology. I done my functional medicine education in 2016 to 21. I certified with IFM. And then I also certified with then Conventional Thyroid Academy. I'm also certified with an functional medicine university. And you can see in last 2, 3 years, I treated more than 5,000 patients about thyroid, diabetes, and all these things. And then my passion is started teaching and how we started the academy. And one important thing that make you hero of your patient, even your patient is consulting to a doctor for more than 20 years. When you show this thing to your patient, that will boost your confidence, that will boost your patient confidence multi times. I'm seeing this with many practitioners and many doctors, they come and they use one. See, every patient will come with an information to you. They have a lab report, they have a history, and all these things. But if you learn to analyze this one with the help of technology, then it will transform the patient's lab into something that will help you to identify this one. Because patient is going to the doctor and doctor do a regular lab, and when the lab come to the patient, they will say, oh, everything is fine, nothing to worry, just go and just do it one. But when you analyze this one, you will find out the multiple dysfunction. Now, I would like to tell you something over here that just look at me, that forget about the disease. Now, if you do the continuum, then one side we have health and one side we have disease. It's a continuum. Now, your thinking and what the final thinking I would like to change in you is don't chase the disease. Forget about the disease. Disease is absence of health. Chase the health. If you create the health, the disease will disappear. And by the way, this is how the disease appears. It's a continuum. So you start with an dysfunctions, and dysfunction will remain for 10 to 15 years, and then you start having diabetes. Diabetes will not develop overnight. That Sunday your sugar is normal and Monday you develop diabetes. It is not like that, except your type 1. So it will take on 10 to 15 years to develop the sugar abnormality. So once you learn this tool and you will be familiar with the tool, and you will surprise yourself, and you can get the dysfunction. So you can find out the sugar dysfunction with the lab and information. You can find out this dysfunction, and even you can say normal functions what they have. And then you can learn how to interpret, and with the help of software you can find out what are the rationale why we are saying. And if you give this report to the patients, that will increase the confidence to your patients. So this is what we are teaching in functional medicine, clinical nutrition. We learn all the modules what Arpit has said. We're going to teach you the thyroid and all the dysfunction in detail, how to diagnose, the case study, what are the lifestyle intervention you can do, and that's how you can make a customized plan. So what you learn is how to find out the root cause, how to treat the root cause. So that's all about functional medicine practice. And functional medicine, by the way, it will make you apart from the rest of coaches if you learn and certified in functional medicine. That will boost your career, and that will help you to learn more about the functional medicine. So yeah, Arpit, I think from my side, I'd explain in a depth what we can teach and what the potential the functional medicine have. And by the way, this is the movement that is started around the world and in India. In future, we need functional medicine coaches and functional medicine practitioners to change the disease paradigm. And that's why if you are part of this journey, that's you are welcome, and we encourage you, we appreciate you. But if you are not be a part of the journey, then you are missing out something. Am I right, Arpit?
Yes,
Because
yes,
when I started my career 10 years back, nobody know about the functional medicine. I had very hard time. But within a 5 years, I am changing that every day. I'm getting a call that I want to learn about the functional medicine. What is functional medicine? And people are approaching me to get the disease reversed. And we need a lot of coaches. So it's not a one-man show that we can change the patient lifestyle. It's a holistic approach. So we have to combine with a doctor. We have to combine with coaches and nutritionists. So we have to build a team, because
abs-
finally it's a lifestyle change.
yeah, yeah.
So
That's what
finally,
we.
just I want to end this
Yeah.
with one simple statement from me. I consider that uh, we can say medical practice or healing is art. Healing is a more of art than the science. Science is there, of course, science is there, but I consider medical practice is actually healing. and healing requires a lot of art rather than science. So many of doctors, they argue with me that we are the best evidence-based medicine in this world. But I'm saying that, your evidence-based medicine is not required because healing is art and then medicine. Yes, thank you very much.
Thank you
Lovely
so
talking to
much,
you.
Dr. Anish. It
And
was it
yeah,
was beautiful, the presentation and your insights, especially when you said chase health and not the disease. That was like a bulb on moment for me, you know. So
yeah.
yes, that is what it is, and thank you so much for this amazing presentation. I think we got a message from Rajan also. He said, "Thank you for the amazing session." So yeah, thank you so much, Dr. Musa, and your experience and whatever that you've done in this field so far has been commendable. And there's like tons of respect from us and the community, and love what you're doing in this space. So just going back to what we were talking about initially, that we are starting this health coaching course, right? Wherein functional medicine is going to be one of the most important aspect of this health course, right? Because like we discussed that finding out the root cause of the issue, because parallel to what doctors are doing, of course, if it's an acute disease, right? If it's an organ specific disease, then of course doctor intervention is needed. But parallel to that, there has to be healing that should be happening. And very rightly, Dr. Musa said that it's an art more than it's a science. You have to find that sweet spot over there. So just with your permission, I'm just going to share my screen once again. We'll just go over it. What we are trying to achieve with Vitaliss Academy, and then post that we will take questions if you have any. And yeah, so basically, it's a 3 months of certification that we're going to be doing at Vitaliss Academy, right? So it's a 12-week program wherein we do 2 to 3 live classes within a week. Of course, every week there is like functional medicine discussion that happens. There's business module. There's communication, which is very important as a health coach. When you become a professional, communication is one of the most important aspects that you should be focusing on, the professionalism of things, right? A lot of people who join our courses. A lot of our students are fresh graduates also, right? And they haven't entered into the professional industry. So it's very important how you conduct yourself professionally, because that eventually brings trust, right? So functional medicine paired that with business insights, communication, your branding, marketing, everything, right? And then 6 to 7 hours per week is what you got to give to this. We have the top healthcare professionals. We have Vitaliss Academy. And then industry experts and healthcare. And these are not just the people who are just the people who are fresh out of college and now they are teaching you, right? It's not like a literature course wherein you do a course and then the teachers are now training the students. These are industry professionals who are within the industry, just like Dr. Musa is there. He has had a successful career for more than 2 decades, right? It's me, like I am a marketer who has been working with health and wellness professionals day in day out, right? So these are the industry experts from healthcare and business field, right? And basically, these are just the highlights. It's a collaborative learning, right? Uh, Not just you don't just learn from the doctors or the teachers who are going to be teaching you. All of us are working professionals, right? These are nutritionists, fitness trainers. So there's a lot to learn from each other also. So it's basically a community-based learning. And then, of course, right after the completion, we give you the internship. There's a hands-on experience that you have, right? Right after your completion, there's 1 month of practical just to assess how much you've learned. And then post that, we start giving you clients that you work with so that you have a real-time knowledge, right? And then, of course, if you want to build your business, then we've been doing it for ages. We can help you build a successful online business as well, getting you new clients. How do you close them? How do you bring about the change in terms of your career? In terms of, if you're thinking purely from the profit perspective, we can talk about that as well, right? And then why choose this? Because uh, yeah, we teach you a lot of these things: effective communication. We offer a paid internship. We teach you about social media marketing. We help you with the online successful business sort of places also, right? We help you build your personalized website. We help you build your funnels, marketing funnels, sales funnels, everything that you need to build a successful health coaching business, real life impact, and talking in terms of a lot of doctors who join this course and nutritionists and fitness trainers. You really want to bring about the change in your clients' lives, right? And people who have so like I keep saying this thing that everyone wants to be fit December 31st, and the time is going to come soon. Everyone is going to take a resolution on December 31st to be fit by January 15th. They'll be out of the gyms or they'll be out of their yoga classes. But these are the people who really need your help, right? Where you step in, you help them get better in terms of health. So I would say just learn, help, build, right? Whatever that you want to. Health is a noble profession. If you want to get into it, kudos to you, and we'll handhold you for however long you want us to, right? And let's really create an impact there. And these things we have discussed already. There's a really high demand at the moment. Let's create like personalized, be the hero, just like Dr. Musa mentioned, be the hero in your client's journey rather than just one more service provider, right? um, be the expert, know what you're talking about. I've seen a lot of fitness professionals, no dissing or anything, but yeah, just the take this whey protein and take that supplement is not going to lead the client anywhere or your profession anywhere, right? This is one of our faculty, Sachin Sharma, a very huge influencer. He's a trail runner, has received multiple awards, right? He's going to be talking about the social media aspect of things, right? Very successful online, offline. He's been representing India across the globe in running, trail running, right? One of our faculty, Mr. Manan Datta, has been able to build one of the most successful MMA chains in India. So he's going to be talking about the business side of things, of how you can build a successful business if you want to in the health space, finding your niche specifically, right? No one is looking for to join gym. No one is looking for a yoga class. Everyone is looking to get better in terms of their health, right? Until and unless you're actually getting into yoga for yoga, which is mostly professionals who want to get into yoga, but your target audience is not that, right? Your target audience is people who want to get better in terms of health. So might as well just learn health on a deeper level. Dr. Shweta Devan, a nutritionist with more than 15 years of experience, has worked with 40,000 clients till now, and has been able to help them heal using nutrition. And she keeps this USP where she says, "We help you heal with your favorite food." So yeah, it would be an amazing experience to learn from her. Foundation of functional medicine is what you're going to be learning. Patient-centered approach, integrative strategies. There's nothing happens in isolation. We're not focusing on just the liver, just the kidney, or just the that. It's much deeper, right? Root cause analysis of things. We have gone over these things. Dr. Musa has discussed all of these things in depth already. We'll be talking about functional medicine. We'll be talking about detoxification, elimination diets, health coaching essentials. There'll be, behavior change techniques. We'll be talking about psychology as well and effective communication. Then we go on to the brand development, digital marketing, and business growth is what you're going to be learning. Real life case studies is what you're going to have here, hands on experience with real clients. We'll be assigning clients to you post the completion of the course, like we discussed, right? And then there's going to be a final project, and post that, once you become part of the Vitaliss family, we make sure that you have a successful career, right? 3 months of training, right? 1 month of practical post that. We assign you a client during this practical. You work with the doctors who are there within the faculty, right? You work with them, and once you're done with the practicals, we assume by now our student knows what it is to work in this space, and they can single-handedly work with the clients. So that's how the career trajectory looks like with us. Any graduate or the diploma holder, a lot of times our students ask, do I need to be a doctor to do this? Of course, it's always, doctors can always join this, but it's a beginner friendly course, right? Any graduate or a diploma holder can do this course. It's not very information or very word heavy, right? We try to make it very simple for each and everyone, and a very comprehensive curriculum. Skills, nutrition, lifestyle management, everything is discussed. Who's eligible? Like I said, everyone is. Anyone who has a diploma or a graduation. 12-week course, right? 2 to 3 live classes in a week. And would you get clients after the completion? Of course, I've said this multiple times. You will get the placement. You will get the placement support. You will get the clients post the completion. You will receive a certificate from Vitaliss Academy. Are you ready to take the next step? You can do that by booking in a call with our career advisor, right? Uh, so I'm just going to. You should have hunger for learning. Yes, sir. Very true, Dr. Musa. And I am just going to drop this in the chat here. Anyone who wants to book in the call with our career advisor, age limit, fees to fees, Priyanka. So yeah, we have a lot of scholarships in place, right? So for students, our B Pharma students, physiotherapy students, or the medical professionals, we have a lot of scholarships going on. So yeah, just speak to the career advisor. They'll be able to tell you it's not a one size this thing that we give you when you enroll for this. So we have customized it for every profession that comes in, right? We want to be able to make it available to maximum audience because it's more than about just enrolling for the program. It's more about really creating an impact. So, yeah, just book in the call. Career advisor would be more than happy to help you with this. Everyone just comes in with a passion to help people heal better, get them better in terms of health, etc. I know there's like a fees attached to it, but yeah, we make sure that it's feasible for everyone, right? Now let's take the questions in the chat. Thank you so much, Doctor, for the amazing presentation. Mr. Rajat wants to thank you, Dr. Musa, for the presentation. Will the doctor recommend the health coaches since health coaches will create a competitive market by reforming the society?
I
Your
already
views.
answered that. Yeah, I think I
Okay.
already answered that. There is no competition. And as I said, future we require a collaboration of coach and nutritionist. So in future, you will find out the practice where you see doctors, coaches, and they all come together. Yeah.
Yes, very rightly said. And one of our trainers, Dr. Shweta Devan, so she specifically works in the nutrition space, but she works with a lot of doctors also because first choice is always the doctors with lifestyle disorders, right? I have diabetes, so I'll go to a doctor. So a doctor, like, if they want to recommend to a new,
Sorry, Arpit, we want to change that paradigm. Patients should not go to the doctor first. Patients should
yeah,
be go to the lifestyle doctor first.
of course.
That's why we are here. We want to change that paradigm.
Of course. So so a lot of our coaches work with the doctors, right? There's a collaboration. It's a very harmonious environment that we've created. So we have collaborated with the doctors also, and then if there's a need for the medical intervention, we reach out to the doctors, and then doctors, if they want help with the coaching and lifestyle coaching, of course, this is where our coaches, lifestyle coaches, and the health coaches step in. So it's a very harmonious cycle that we have built. So yes, we'll be collaborating with a lot of doctors also who are who would be able to recommend client to you. So it's always good to have that parallel to, of course, running your online space, right? And age limit, there is no age limit. Fees will be discussed with the career advisor, right? So book in the call. There's no competition. I think we have answered all of the questions. If anyone has any question for me or for Dr. Musa, please just unmute yourself or just drop it in the chat. So here's the link that I've put in the chat, roadmap call with Vitaliss Academy. You can just tap on this link. If you want, I can just show it to you. Some people, face a little bit of issue of how to book in the call. I'll just share it with you. Uh, it's a simple Calendly link that we have here. You choose the date, you choose in the time, you tap on this, you answer all of these questions that we ask you, you put the phone number, describe what you currently do. Are you a student? Are you a fitness professional? Are you a yoga instructor? Any LinkedIn or the website that you have will be able to assess because a lot of time we have to set the profile. We have to check the profile. It's not for everyone, right? This program is not for everyone. So these just help us to assess where you are in terms of your journey, and it clearly is more than about what profession you're in. It's more about the passion, right? So yeah, just answer these questions. Once you schedule the event, it's going to pop up on the calendar of our career advisor, and then they will reach out to you over the call or video meet, whatever. I think Sai, if you have any question, just go ahead. Sambari, Sai, Teja, are you? Do you have any questions that you want to ask us? Okay,
No, sir.
no worries. Sure. Thank you. Thank you. Then I think I'm assuming
Okay. Yes.
everyone.
Thank you very much. See you. Bye bye. Take care. Namaste.
Thank you. Thank you, Dr. Musa. See you soon.
Thank you.
Bye.
See you soon. Bye bye. Take care.
Bye. See you. See you, everyone. Thank you for the great session. See you soon.